Hi, my name is Daniel Farrell. I'm an orthopedic surgeon at Overland Park Orthopedics. When we're discussing total knee replacement, we have to talk about references of where we're going to place that total knee. And one of the reference systems is the mechanical alignment. I'd like to talk a little bit more about the mechanical alignment with models and visuals. You can see this in this video to follow. There's a lot of variables that go into replacing the knee. We have to define what these variables are and find a reference system. The reference system that we follow with the computer-assisted surgery that we do is looking at the hip, knee, ankle alignment. We have to define exactly where the hip and the ankle and the knee are in space. This is the sawbones model, the pelvis, the thigh bone or the femur, the leg or the tibia, and attached to these two bones are markers. These markers communicate with the computer. It's essentially a global positioning network brought into our OR. Essentially a GPS system brought at a microscopic or a minimal level, but extremely accurate. It's defining where this knee is in the alignment of the hip, knee, and the ankle, which make up the anatomic axis. The mechanical axis are just the hip and the ankle alignment. We're going to place a knee or resurface the ends of this knee based on the mechanical alignment. First of all, we need to define how the computer makes up the mechanical alignment. And if you'll follow along with the sawbones, essentially starting off with the setup, confirming is the lift leg, and we define where the hip is in flexion. It's one point. And then moving the hip around, we're taking a number of points in space, and from those points in space we're calculating where the center of those points originate from, which is the center of the hip. Then from there we define where the knee is in space. The hip has been defined. Now we need to decide or tell the computer where the femoral component or where the femur is. First one is the epicondyle, lateral epicondyle, white sides axis, distal medial femoral condyle. And basically what's happening right now is the computer is making many points in space in relationship to this marker, telling it where this knee is, where the lateral distal femoral condyle is, and then where the distal medial condyle is on both sides of the femur. Anterior cortex, and it's registering the distal knee, distal femur. Then the tibia is registered, center of the knee, longitudinal axis. With those points registered, based on the mechanical alignment that we now define for this construct, we can do many of the cuts for the shaping of the ends of the bone. This would then be pinned and the distal cuts be done.